Hello everyone, I'm Dr. Mohan Kumar here. I'm the consultant physician and ECP consultant at Revive Hospital in Mysore. Here we have a very interesting case, Mr. Akhtar Ali, aged around Mekri Akhtar Ali, aged around 72 years. He is basically from Bangalore. He presented with a history of swelling of lower limb for the last 5 years. He visited many of the doctors, many of the different specialties, including Ayurveda, naturopathy, Unani, as well as multiple allopathic doctors. In spite of that, he never had a decrease in swelling of the lower limbs that has been persisting for the last 5 years. Apart from that, he had knee pain and a severe snoring issue and weight issue. He was definitely obese. All those issues related to weight, swelling of the lower limb, joint pains. Physically, he was not very comfortable while walking, while taking rest, while sleeping also. So this was the condition brought to us by by his daughter. So when she came, she said all these symptoms. I said we have a solution for this. So when I said what is the method we are going, how we are going to approach? Initially, we evaluated the patient thoroughly for any of the metabolic disorders. Thorough investigations, including vitamins, heart function, liver function, kidney function, everything was looked at. At the end of the day, we arrived at this is a probably dependent edema due to venous insufficiency. Definitely, patient is not at all comfortable because of the very severe swelling of the limbs. Was not able to move comfortable. One is because of the swelling. Another one is because of the joint pains. So we started with ECP therapy, 35 session over a period of 20 days. Initially for 5 days we gave for one session day, then followed by 2 sessions every day. So after that, patient's condition dramatically improved. His weight also came down. Lower limb edema almost 80-90% has disappeared, and surprisingly, he had a very bad snoring. Even that has come down. So what I would like to say here is ECP therapy is not only for heart; it has got multiple benefit in terms of improving the circulations to various organs, including brain, kidney, liver, heart, nerves, and all the tissues of the body. So when the circulation is improved, better perfusion overtakes all the complications related to hyperperfusion. That's how this patient improved. Now I would like to hear from the patient's mouth and his daughter's mouth itself. What was the condition? How they got improvement in our hospital, and what was the pre and post therapy outcome in terms of comfort levels and physically as well as mentally.
Actually, before I was not able to walk freely. Now, today morning, daily I'm walking around 1 to 2 kilometers.
Okay.
And without any breathlessness and the pain in the knees and all that. It has come down. Reasonably, it has come down. Even when I sleep, I feel comfortable. I get good sleep. And I feel that there's no much snoring also. As my daughter has heard, she has said that no snoring is there.
Okay.
So perhaps she must have noted properly. But I feel very comfortable after this treatment.
So last 5 years you have been suffering with swelling,
yes,
joint pains, all those issues.
Yes.
So now it has dramatically come down.
Dramatically come back. Yes.
Yes.
The pain has really reduced.
So what I want to say here is we have not given any painkiller for this patient. Absolutely no painkiller. We are trying to give medication which will improve the cartilage of the joints. So without painkiller, his joint pains has come down.
Yes, I felt like that. I really felt like that. It was good. The treatment is also very simple and very nice, without any surgery or something like that. It is non-invasive type.
Yes.
It's really comfortable for the patient.
Yes.
He will have full confidence and he will utilize that
therapy. Okay.
Therapy.
Madam, what's your opinion? What was your father's condition before and after, and why did you come to us? Yeah. Come to our hospital.
My point of view as a daughter, it felt very bad to see that edema. It was increasing day by day, and he was. It looked very painful. I don't know. He wasn't sharing with us maybe, but it looked very painful. And despite trying so many different treatments for 5 years almost, it wasn't improving at all. So when we came, we didn't know that it will really reduce. But I'm amazed.
Due to that swelling, I was not able to wear the shoes also. swelling.
It was very huge. We were thinking it was going towards elephantitis. You know,
Okay,
it felt
filariasis,
that
okay.
bad.
Yeah, okay.
So
Lymphedema.
we were very much afraid. Now I'm amazed at the result. It's
Okay.
almost gone.
Very good. So what I would like to stress upon here is, if the patients, when the doctor talks to the patient and convinces about the treatment, there are two aspects. One is patient has to understand this approach or treatment is going to work. If the patient has got confidence in the doctor, and if the doctor confidently explains how we are going to achieve the results, and it is two-way, both the patient as well as the doctor has to communicate and accept. If the patient does not cooperate, definitely our treatment will fail. So my duty is to explain how my treatment is going to work. Your duty is showing your confidence in the therapy. When both works in tandem,
Yes,
the results are excellent. And you can see here in this patient, is dramatically improved. His swelling of lower limbs has dramatically improved. His confidence level has improved. His joint pains have almost disappeared. And surprisingly, snoring has disappeared. And also his weight, almost he has lost around 8 kgs in the last 20 days. And he is comfortably moving around. So this I would like to stress to all doctors and all other viewers. There is something called innovative treatment approaches which are USFDA approved without any side effects. Unfortunately, majority of the patients may not be aware about these therapies. So these patients from Bangalore, somehow somebody has guided them to Mysore. They have shown the confidence and taken the treatment. Ultimately, they can see the benefit what the patient has received. With that, I would like to end my today's discussion. Thank you, one and all.